when lives are on the line.
Are there any obvious injuries?
These men and women will risk theirs
The lad who was driving got blood coming out of his face.
to save yours.
RTC truck.
They deal with the most serious injuries.
The patient is described as bleeding heavily.
Directly below his ear. There's a lot of blood there.
The most critical illnesses.
The reports of a male who's in cardiac arrest, and without any action, the patient will die.
The 2 Yorkshire Air Ambulances cover Britain's biggest county.
He's fallen 30 foot from the roof.
Oh, yeah.
He's got a big cut to his head.
5 million people rely on them
All right, sorry, sweetheart.
to deliver cutting-edge emergency medicine
We're just going to go to sleep. He's not looking particularly good.
at high speed.
If you can activate your major hemorrhage protocol.
Every day brings high pressure.
2 minutes and the patient is numb from the waist down.
If anything starts to hurt or anything changes, shout out, all right?
I'm really sorry, but you've got some horrible leg injuries. They're going to be throbbing, darling, OK?
High stakes.
She's had 2 shots and she's still in the air.
Her heart's not gone back into a normal rhythm yet. You did a brilliant job. If it wasn't for that, we wouldn't have had her heart beating right now.
And high drama.
Yeah, hit the wall with the head.
This helmet has saved her life. Without that, she'd have been dead.
It's lunchtime at the Nostell Airbase, and the team are about to eat.
Oh, that's nice, that.
But dispatcher Gav has other ideas.
Job.
Hit back of a bin truck. Donker, Charles.
Thought his kneecaps are hanging off.
Kneecaps ranging off.
There's been a serious crash outside a prison in South Yorkshire.
Car into bin lorry, into back of bin lorry. So whether he was at the back of the bin lorry, is in working at the back of it.
Oh, right, yeah.
Pilot Jeff will be flying paramedics Rachel and Matt and Dr Becky 15 miles to the scene.
Trail's coming around to the way. What was the ooh for?
Hit the stationary bin lorry at approximately 40 to 50 mile an hour.
All right, nice.
Query kneecaps hanging off, patient GC.
Ouch.
Tourniquet has been required. Maybe somebody's took the belt off.
Yeah.
It sounds like quite a serious job. So it's a road traffic collision where a car collided at high speed with a stationary bin wagon, so a large immovable object. And it sounds like the driver's got some quite significant injuries to his legs. We don't really know much more at the moment. We're waiting for some resources to get on scene, but we're travelling there in the meantime. We've heard that a passerby's popped a tourniquet onto a tight band to try and stop the bleeding, and that could be life-saving if he has got an arterial bleed.
3 minutes to run.
Awesome. RRV's 2 minutes and the patient is numb from the waist down.
There's some stationary cars just down at 12 o'clock now. You can see a white van going left to right. Yep. Got an RRV. Got an RRV. To the left.
The crash involves a tipper truck, not a bin lorry.
I'm not going to go in this muddy field here. I'll go in to see this. See this little place just down here. I'll go in there if you're happy, mate. Okay. We're on the soft grass there, aren't we?
A lone local paramedic has just arrived. Traffic is still flowing past the wreckage.
Hello, you OK? I am Becky, I'm one of the doctors.
This is Simon.
Hi, Simon.
Simon's gone into the back of this stationary vehicle.
Yeah.
Speed 40 to 50 miles an hour. Obviously, you can see we've got quite an open...
Got a nasty injury of his leg there, yep.
Dr Becky must get up to speed fast before they can attempt to free him.
He is complaining of some pain to his chest as he's taking deep breaths.
OK.
That'll listen. We've got good equal air entry there. Not concerned over anything that I've heard or not heard.
But Becky's seriously concerned for her team's safety too.
Can we find out where the police are and get this road shut? Yep. Guys, can you just stop any traffic coming through now? We're going to have to stop it completely.
All traffic!
And that's as far
All
as we've
traffic
got
stopped.
so far. So, cannulator with a view to getting some morphine in him.
Super, sounds like a fabulous idea.
To draw up and
Absolutely,
continue with
please
that?
do. You're doing an absolutely grand job. So we're going to stop all the traffic and get this road safe for us to work on.
Simon's legs are wrapped in twisted plastic and metal. He was on the way home from work at the local prison. A colleague stopped and applied the tourniquet to stop blood loss.
I'll stay behind him.
OK.
So what he's done is come out.
OK.
He's been doing probably 40, 50
Yeah,
miles.
that's what he said he's doing. Yeah.
He says the sun's seen it, he's sneezed.
Glare in the sun.
And
He's hit the back.
straight back.
Becky's also concerned about internal injuries. A broken pelvis can cause lethal bleeding.
So injuries-wise, complaining of chest injuries, but it's got good bilateral air entry, talking in sentences, not in respiratory distress.
Yep.
Looks like the airbag's gone into his chest.
Yep.
He's on Entonox. He's got a horrible open injury to his right knee, where it's clearly gone into the dashboard with a makeshift tourniquet applied by the guys that have been first on scene from the prison. Observations, according to this gentleman, were normal. Didn't give me numbers. I was just going to go and try and see if we could get him onto some sort of proper monitoring continuously, as we're going to give him some...
Do you want me to...
Yeah, do you want to get some
around
on
the other side?
Is Matt bringing helmets?
Yes.
Lovely. Might leave you with him in the car while fire take him out.
Extricating Simon will take time and may worsen his already serious leg injuries. The lorry driver is in shock.
I was just going to a quarry. I've waited at the traffic lights, I've put my handbrake on. 10-15 seconds later, I felt my lorry shoot forward. I've got out and I've seen Simon stuck into the back of my lorry. I don't know, mate. I don't know. It's just a bit shocking.
Looks like all lower leg with a bit of airbag to his chest.
We were just saying his chest is starting to get a little bit more uncomfortable, so it's just stopped on Entonox for a little while.
Okay.
When I see the car, I thought, oh no. First thing I did was open the door, made sure he was conscious, made sure see if he wanted to make a phone call or anything like that. My main priority were him. I'm all right. It's 32 ton just sat there and he's just run straight into the back of it, so he's a priority.
Simon needs reassurance as well as medical care. Firefighters will be cutting just inches from his legs.
Just going to get a little bit noisy while I take this off.
This here, just a little bit of noise, mate, all right? Yes, mate.
Whereabouts is it actually hurting in your chest, sweetheart? There. Is it tender when you press on it?
It's just a little bit.
I think it's from where your airbags...
Just struggling to now.
Got you. All right.
I think now because...
Adrenaline's wearing off a little bit.
Simon, right, mate, this door's going to come off. This side's going to come out. And then we're going to hopefully bring you out this way.
How old are you, Simon?
36.
36.
Firefighters are about to start work. It will be a complex operation with a real risk of worsening any internal injuries. But there's no alternative. Cyclists love the steep hills of the Yorkshire Dales.
Directly on top of the grid is where the call were.
But today, Helimed 98 is on final approach to the scene of a serious accident.
My name's Paul.
Yeah.
I'm one of the paramedics on the helicopter. Tell me what's happened.
Yeah, I hit the wall with my head.
Okay, and do you know roughly how fast you're going?
Oh, I don't know, quite fast.
Quite fast, okay. Were you knocked out when you hit the wall?
No.
Cyclist Karen Wheeler's tyre burst, and she was almost thrown over the parapet of a river bridge.
And whereabouts is it hurting most?
It's tingling on my arms.
On both arms or just one?
Ow,
Yeah. You can feel me touching you, can't you? Yeah?
Yeah.
Feel that?
Yeah.
You can feel that, can you?
Ow.
Is that painful? Whereabouts is it? On your shoulder?
No, just on the arm.
On your arm? Okay, no problem.
It's a 20-foot drop to the water. Paramedics Paul and Matt and Dr Steve can see their patients lucky to be alive.
Karen head-butted the bridge. Thank God she was wearing a helmet, and that saved her.
You don't take medication for anything?
No.
You're not allergic to out?
No.
Other than brick walls?
Yeah.
Karen was out riding with an all-female cycling group, tackling a 30-mile route through the Dales.
Most of the impact seems to be in her arms because she's jarred into the bridge. So that's where she's complaining about the pain at the moment.
Right, sweetheart.
Ow.
Sorry, I'm just going to try and take your glasses off so it's not digging inside of your face.
She was travelling at close to 30 miles an hour when the puncture locked a wheel, hurling her off.
Quite a mark on there, isn't it?
She's been given gas and air for the pain.
I wanted to move her arm down so we could roll her that way onto the scoop, but she just weren't tolerating it without any analgesia. So I'm going to cut this glove off. We'll see if we can get a line in. If not, we'll just roll her over as best we can onto the scoop.
Ow.
Just want to get your gloves off so we can have a look at everything.
Karen's arm could be badly broken, but she may also have more serious injuries.
Ow. Don't move my arm.
We'll try not to.
Don't move my arm, please.
Okay, just pop the strip to the
Please don't move my arm. I don't move my arm. Ow, ow,
Look at that.
It's vital they move her onto a spinal stretcher. The impact could have broken her neck too.
How are you feeling?
I'm fine.
Good?
Yeah, just move me.
It's not the most comfortable of the places,
No,
is it?
morphine's definitely working.
Good. Okay.
Karen's a member of the Yorkshire Lasses Cycling Club. She's super fit.
Keep your arm there, keep your arm there.
Can you straighten that leg up a little bit first, Karen? A bit more up. That's it, fantastic.
But this procedure is going to be an ordeal, even with morphine.
Ready, steady, and roll. Brilliant.
Without x-rays, the team must work on the few clues Karen's giving them to identify her injuries.
Okay, guys, make sure she's on the board, and if you can slide the board down.
That's it, good.
Whereabouts is that pain?
It's down my arm. Top.
Both arm or just one arm?
Top both.
Both tops of both arms?
Yeah.
Okay, just bear with us.
But it could have been so much worse.
That helmet's done an awesome job.
You want to pop that in a glass case when you get home?
Right, I'm just going to press there. There's no pain there at all, is there?
No, there's nothing down the back, the sides, the chest. It's just the arm.
Her symptoms aren't raising any red flags for Dr. Steve. She's going to go to the local A&E by road for tests, rather than a major trauma centre. Her escape's a great advert for cycling safety gear.
This helmet has saved her life. As you can see, they're meant to crumple, a little bit like a car if you like, crumple zones, and that's exactly what it's done. Any fall at any speed, hitting a wall or hitting tarmac, is going to cause your head to hurt. Without that, she'd have been dead.
It could be a while before Karen's back in the saddle, but without her headgear, this could have been her last trip to the Dales. On a main road in Doncaster, firefighters are working to free prison officer Simon Watson from his crushed car. He's been trapped for more than half an hour.
We've got a gentleman who's been driving along the road, and there's a set of traffic lights. The lorry's stationary at the traffic lights. The gentleman's been blinded by the sun, not seen the lorry, sneezed, and then has then gone into the back of the lorry at about 40 miles an hour. He's got significant injuries to his right leg and is currently trapped by the dashboard up against his legs. He's quite stable, he's chatting away to us, so we're just working with the fire service at the moment to get him out of the car as rapidly as we can, but as safely as we can.
Watch his leg if you can, guys. I know it's a bit awkward.
Simon was driving home after a 5-hour shift. Now his right leg is shattered and he's at the centre of a major rescue operation.
Yeah. How much morphine did you give him, sweetheart?
He had 2.5. So
2.5, cool.
His chest pain is under control, but paramedic Rachel is monitoring his blood pressure and breathing carefully. It's feared it could be a symptom of internal bleeding.
Yeah, it won't be too long. We're just going to take that B-post out.
Yep, and then we're going to swing him out sideways, I believe.
It'll all be open. There's enough room to pull him out that side anyway.
We'll keep him as still as we can, but he's moving his head freely, so we can probably get him to help us and shuffle him round, I would imagine.
How's your leg feeling, Simon? How does your leg feel? Is it particularly painful? Can you move your foot at all? You can move it, yeah?
Firefighters are making progress, and Simon's left leg is now free.
He can move both his legs, so it should be able to twist him out.
We just twist him out, and then we just need to try and skin to scoop him as best we can.
Yeah. You all right, sweet? Can you feel vibration?
Yeah.
Just my right leg now starting to prop up from.
Okay, all right.
Simon's almost free. Firefighters have had to cut through the safety shell of his car, but lifting him from his seat is going to be agonising.
Right, I think we're almost good to go, guys.
Your last BP were 124. We're getting ready for moving him. Do you want to just give him a tad more morphine and then we've got him?
How much did he have?
He's had 5 up to press. Okay. He's only given it in 2.5s.
Simon's been given a large dose of morphine.
This is where it's going to start to get uncomfortable, sweetheart, all right? If you feel you need to swear, you need to shout out, just do it, love, all right?
Dr Becky's concerned about causing more damage to his right leg.
How far does that left leg wound extend? Have you been able to see?
I think it's going quite a way down. There's that much powdered glass knocking back.
So he's got very significant lower leg injuries from his sort of bottom of his femurs, so here downwards. We haven't been able to fully assess them because he's trapped in the car at the minute. So that's fine.
They're about to start the final stage of his rescue.
So what I need you to do is, I know you've got no pain in your neck or back, but I just want you to try and kind of just be steady with it, just look after it. If anything starts to hurt or anything changes, shout out, all right?
Right, so Simon, I want you to go back with the chair. We're going to go as slow as we can, OK? Keep coming.
Just support his neck.
Well done.
Just hang on, rest.
Stop.
That's your max on chair, so yeah, that's...
What's hurting at the minute, Simon? Your neck's hurting.
Is it across your shoulder, top of your shoulder there?
Round here? You've got a seatbelt marking like that. Okay, yeah, so we'll just mind his C-spine as we come out. All right.
This chap's been trapped kind of just below his knees, and he's got quite a nasty knee, sort of patella, and just below his patella injury. It's open as well. But we're trying to be careful, obviously, that when we start moving him, it doesn't exacerbate that injury. So we're just kind of rolling the seat back to give us enough room to then negotiate his body out of the car.
Okay, is anybody not ready? On 3, 1, 2, 3.
You're doing really, really well, Simon.
They must move him inch by inch to protect his legs.
Can we roll him ever so slightly to that side so that we can get the board underneath him, and then we can just slide him round and pull him out? Yeah. Right, Simon, what I want you to do, with the help of these guys, I want you to just roll towards your left a little bit.
If you pull it up now, it'll lift him.
And then that should lift you up enough for us to get this board under your bum, and then we'll make it a lot easier to get you out. Can you do it on move? Okay, so we'll go on ready, steady, move, and it's on your call, all right?
Ready, steady, move.
Right, shove that board underneath. Keep going, keep going, keep going. Right, that's it, perfect. Just have a breather there, mate, all right.
Well done. Brilliant, mate.
Right, so he's got some open wounds to that other leg, all right, so we just need to be mindful of both his legs, all right.
Are we going to slide him that way then now?
Yeah, we'll slide him towards you guys, yeah, and we'll rotate him once he's nearly out.
Yeah.
Yeah, are you happy with that? Are you guys happy with taking the support?
Yeah.
So if you want to call it again, ready, steady, move, and then we'll move him, slide him this way a bit further, and then going forward we'll be able to slide him round, all right? Yeah. So on your call, I've got his leg.
Anybody not ready? Ready, steady, move.
That's it. You all right, Simon? Somebody else swap for head.
I've got him nice here.
Right, so we'll go on move again, all right, on your call. Yeah. And it's ready, steady, move, okay?
Ready, steady, move.
That's it. Don't worry too much about your legs, sweetheart.
That's it, that's it.
Right, and a little bit further up the board. So again on move, ready, steady, move, all right?
Ready, steady,
Mark, just get in there if you can.
That's it, we're on.
Right, just lift the board up slightly. The stretcher's going to come underneath you.
All right.
You got the head.
Somebody call it then. Ready, steady, move.
And again, when you're ready.
Ready, steady, move.
At last, Dr Becky can properly examine Simon.
Right, that's it for the time being.
Cool. Can I get in, please?
Yeah, absolutely.
Thank you very much. Right, lovely. How are you feeling now you're out?
All right.
Better than in the car?
Still throbbing.
Your legs are still throbbing. I'm really sorry, but you've got some horrible leg injuries. They're going to be throbbing, darling, OK? I'm afraid we're going to need to cut all your clothes off so we can get you packaged up properly, OK? You're definitely not allergic to anything, are you?
No.
All right, we're going to give you some antibiotics just because the last thing we want is infection to get in there. So we're going to give you antibiotics as quickly as we can, OK?
So far, his blood pressure is holding up, meaning he's unlikely to have further internal injuries. And there's more good news.
Simon, can you straighten your left leg for me, sweetheart? Brilliant, well done.
Miraculously, his left leg has escaped major damage.
Big deep breath as best you can for me.
Sorry,
is that your leg?
sweetheart.
Yeah. OK. Are you all right if we use your phone to take some pictures of this cut on your leg so they can see it in hospital without having to take the dressings off? Is that OK? Yeah. While we get some dressings ready.
Do you want one of our blast dressings?
Yeah. So we're going to put a big dressing on this leg of yours, OK? And then, are you able to straighten that right leg or not? You can say no if you... No. OK, that's fine. We'll package as it is, all right? And then we'll get you in the back of the ambulance. Simon's got some really nasty injuries, particularly to his right leg, where he's got obviously a disruption of his knee joint with both bone and soft tissues exposed and quite a lot of skin damage, as well as all the soft tissues that normally connect your knee together all seem to be completely disrupted. That's very painful for him, and he can't actually straighten that at the moment. So we've dressed it in the position it's in and given him some antibiotics to try and reduce the risk of infection. He'll need to go to theatre and have that repaired.
Ready, steady, roll. There we go, sweetheart. It's cold, but we'll get you warmed up.
At the moment, the outcome he'll get from that surgery is really unclear. It's a really significant knee injury, so it'll depend what it looks like when he gets to hospital, when they do some imaging of it, and then when they get to theatre, how much soft tissue and how much bone damage there is as to whether he'll get full function back in that knee or not. So he's off to the Northern General now with the ambulance crew. The trauma team there will assess him fully and take his treatment from there.
For the last hour, Rachel has shared with her patient one of the most stressful days of his life.
Right, Simon, we're leaving you with these guys. You take care, all right? I hope you have a speedy recovery.
Well, he's got a complete dislocation of his knee joint.
I didn't have a really good look at it, to be fair.
So you can see his femur, and then his tibia is sat here.
So
he's got a complete dislocation of his knee joint. His patella is probably gone.
But his injuries could have been even worse.
So the car's clearly gone into the back of a stationary lorry, and the crumple zone at the front of the car's done its job in that it's crumpled, but the transmission of force up through the vehicle, you can see, has been really significant because it's actually managed to bend the roof halfway down the car. So you can see the crinkle marks along the car where the forces have been pushed through the framework of the vehicle. The forces that have been exerted to the car have also been exerted to the patient, so if it's strong enough to bend metal like this, then the forces are significant enough to damage the person inside as well. And you have to remember that your soft tissues and your organs inside the rib cage and the solid structures of your body moving at the same speed as you, and if things stop suddenly, then they also collide then with the solid wall of your chest and your pelvis. So we're always looking for internal injuries that we can't see on the outside, despite the significant distracting injuries to his legs.
Simon is on his way to scans, x-rays and surgery. Thanks to the helicopter, he's had a hospital consultant by his side throughout his ordeal. Speed is what saves lives every day at the Yorkshire Air Ambulance base.
Radio lights.
Radio's good, landing lights on.
Auto trim.
Believe as it is.
And breathe.
Over the top of the hangar. And lifting.
There we go.
It's less than 4 minutes since reports of a cardiac arrest came in. And paramedics Paul and Gav are airborne with Dr Sarah.
The main concern at the moment is this patient's collapsed to the floor in the street. Initially he was breathing, but it seems now that his heart has stopped, and the people who were surrounding him have started to do chest compression, so it's presumed that his heart has stopped and he's trying to be resuscitated.
First aid training means more people are surviving what would be fatal heart attacks.
Bystander CPR is massively important. If the heart is able to restart, or if we're able to assist it to restart, the brain's been protected to some extent in that period. The patient will have a better outcome in the longer term.
But all the seconds saved by the helicopter's speed could be lost if pilot Steve can't find a place to land.
What do you reckon?
The only thing I can see is where that black car is now at about 4 o'clock, that like next to the football pitch.
Dr Sarah is carrying drugs most ambulance crews can't provide. They could be critical to the patient.
Just keep describing it to me, Paul. I'm not sure what you're
come round now, you can see quite a tall building with a clock on it at 3 o'clock. Football field to the far side of that. There's a black car in the corner.
Oh, that car park there, Steve. Just next to the football pitch.
Oh, yeah.
It's at the wrong side of the railway line.
It's the wrong side of the railway line.
Yeah, but it's straight down that road and turn right over the railway bridge.
The patient is lying in the street in a busy suburb of Sheffield.
It's probably the best way, mate. I think we'll just go for that.
Steve's landing in a car park surrounded by obstacles.
I just don't want to go too much further forward because of I don't want to blow the rubbish out of that poor little black car. Right, that looks good there for me, guys.
Local paramedics are with the woman.
Yeah, still in VF. She's had 2 shocks up to now and 2 adrenaline. Okay.
66-year-old Pamela Land was being driven by her husband Steve when she collapsed. He started CPR.
What's she had? How many shocks has she
She's
had?
had 2 shocks and she's still in the But I think they want to get her out of the public view, I think, which is fair enough, really, I suppose. So.
Her heart's not gone back into a normal rhythm yet. We want to just get her off the road and into the back of the ambulance and then start some further treatment.
Pamela's showing signs of responding.
We've got a good end tidal, so she may well have a ROS.
Carbon dioxide is still coming from her lungs.
She's breathing.
Meaning she's still absorbing oxygen.
Got a ROS.
Then, miraculously, her heart goes back into rhythm.
This lady, I believe, is on a collapse in the street and witnessed cardiac arrest. The crew's done a fantastic job, and we have got a ROSC. So the patient is breathing to herself, heart is beating, but she is unconscious GCS3. We're going to take her to the nearest hospital, which is Rotherham.
Speed is once more critical to Pamela's survival. Driving her will be faster than flying in this case.
See what the second blood pressure comes up as.
Now we're on our way. Heart rate's come up actually really nicely.
But Pamela could go back into cardiac arrest at any second.
Okay, so airway-wise we're okay-ish with the eye gel seems to be working. She's got good bilateral air entry. Her end-tidal CO2, that's just because you're bagging her up and she's fairly low flowish.
Sarah's taking stock. If Pamela's to survive, nothing must be forgotten.
Well, Pamela's had a return of spontaneous circulation, which means her heart started to beat by itself again, but she's still really quite poorly. She started to breathe, but not quite well enough, so we've put a tube into her mouth, and we're just supporting her with her ventilation, so you can see that Paul is bagging some oxygen into her chest. We're just preparing some drugs, so if her heart were to stop again, we do need to give her a specific drug to try and allow us to re-shock her and to bring her heart back into a normal rhythm again, so we're just preparing that.
Like many victims of heart attacks, Pamela hadn't recognised its lethal symptoms.
So I understand that Pamela actually hadn't been feeling very well for a few days with some pain in her upper stomach. So her husband actually was taking her to the A&E department anyway, and she became unwell on the way to hospital. So she was witnessed to collapse, and when she collapsed and stopped breathing, she had CPR immediately, which is the reason that her heart has restarted.
Pamela, won't be long, sweetheart, all right.
Then her heart trace worsens. Another attack.
I think what's happened is we have gone into an ST elevation, actually.
Sarah is concerned Pamela is going to arrest again, but they're close to the hospital.
Yeah.
We could divert to Northern.
I think the problem is we're here. And so I think it all becomes a little bit awkward then, doesn't it? But it's, oh, she's just flipped in and out of that.
Sarah's decided to stabilise Pamela in the local hospital, but she may soon need a transfer to a specialist cardiac unit.
Her heart has started, so her heart's beating and she's breathing by herself at the moment, but she's not doing a great job, so we're just trying to support her with that a little bit. So we'll get her straight in there now, and it's very likely what we'll do is have to give her some medicine and put her to sleep so that we can change this tube and breathe for her all together so she's not trying to work so hard herself. Okay, we've done a couple of heart tracings. I think she probably had a heart attack.
She suddenly stopped breathing, went frothy. It was like gurgly noise. I couldn't feel a pulse, so I dialed 999. It was in the car coming in.
I know.
And they said get her out of the car, so I couldn't move her any further.
No. You did a brilliant job. If it wasn't for that, we wouldn't have had her heart beating right now. So you knew you've done great, and I'm sure it was really scary.
She was just gone.
It's been a terrible ordeal for Steve.
1 minute you're sat in your front room, then you go sat in your car to take your loved one up to the hospital because she doesn't feel very well, and the next thing she's sat at the side of you with the head slumped down, not breathing and no pulse. A couple of very nice young ladies stopped because they couldn't get up or down the street. So they stopped to help me, one of which went to fetch a defibrillator which had just been put on the local infant school wall, and she was unpacking that while I was doing the chest compressions, because the defibrillator tells you what to do and you want to do this, and I was too busy doing the compressions. And then, like I said, the ambulances came, and wow, so nice to see some help. I just couldn't do it myself, and she needed help. She got help. There would have only been one certain outcome without all that help, and I'm just so pleased that so many people could come and help me.
The fight to save their patient is now out of their hands. The team must return to base and await news from the hospital. It's harvest time in Yorkshire, and the combines are hard at work. On the air desk, duty dispatcher Sammy is scrambling the team to a farm.
So, it's a tractor driver, for whatever reason, has driven into an electricity pole. Yep. The electricity pole has caused a fire, and the field's on fire and so is the tractor, and he's still in it.
Pilot Elaine is flying medics Andy, Rachel and Pete to the scene of the accident.
Okie dokie. Lift and go.
Okie dokie. Clear left.
Tar.
Yeah, we're just starting to rain.
Could be easy to spot this, isn't it?
Yes.
Yeah, apparently the tractor's not on fire, it's just the field surrounding him is on fire.
Alright. The tractor's gone into the electricity pylon, is that what's caused
Yeah, and then I'm guessing the electricity pylon's come down to set something on the field on fire.
Okay.
But we don't know who's rung it in.
They're heading for a farm near Goole.
This is a slightly unusual story. What we've been told is that a tractor has driven into an electricity pylon in a field. Somehow, I don't know whether the wires have come down, but that has caused a fire in the field around the tractor where the patient is. We don't really know whether the tractor has caught fire or whether the patient's been burned. And obviously there's kind of scene safety issues as we approach this job. So, yeah, it's certainly not an everyday job, but potentially very serious. 8 minutes.
More details are coming in over the onboard computer.
So an update from Sammy. There's a fire on the scene, as in fire brigade, awaiting Northern Power to switch electricity off before they can extricate the patient. And the query calls as to why patient, hit call, query and medical event. No wires are still alive.
Wow.
Oh, there's the fire on the nose.
Oh yeah, visual.
This will be a tricky mission for Elaine.
Right. Where is it safe to land?
If she lands downwind of the fire, Helimed 98 could become another casualty of the incident.
So the tractor's there, isn't there? I can see a car, can't see any. Oh, fire bobbies are here down at bottom corner. And there's wires running across that field, but obviously not where they used to run, since he's trashed it.
If that fire's out of control, it's not really worth landing in that field. I know it's coming this way.
Yeah.
They're letting it burn out. There's a fire bobby, batting it.
Where's the patient in the tractor?
Yeah, they were waiting for him to turn the electricity off to get him out.
Oh, yeah.
He has actually clobbered it, hasn't he, full on?
Yeah, he has.
You had one job.
Yeah.
Right, so that one goes to that one.
Yep.
And then where's it
They're
going
running, they look to be running diagonally to where the bend is.
Yeah. I'll stick it here. And then if you want me to reposition, I can. Just get on the radio and I'll come over when it's safe.
If the power is still on, the team are going to have to be very careful.
Yeah, that's from 998 when landed on scene.
The tractor driver was lucky to escape with his life when live cables fell on his vehicle.
Hi, love.
Hi there. Yeah, power has been isolated.
Yep.
So the fire brigade and power have managed to get the operator out of the vehicle.
Yep.
So obviously danger level has subsided quite a bit.
Yep.
Obviously you guys were called because it was live power.
I'm guessing you're from the fire?
Farm manager.
Farm manager, right, okay.
Chap with the green t-shirt was the
the driver.
Yeah.
You alright?
Yeah, I'm fine,
Yeah. Have you been injured at all?
No, I'm fine.
Not at all? You sure?
Yeah.
Yeah?
I'm just disappointed in the centre.
So what happened?
I was just looking behind me and the next thing I know I heard like a crack and I looked forward and then
So you
down, so I just,
did you have a dizzy do or
no,
you didn't catch? So you were just looking behind you?
Straight away, yeah.
Okay, and when you jumped out you've not hurt your ankle, your knee, anything like that? Do you want checking over or anything, or are you happy that you're not injured?
I'm fine, yeah, I'm fine.
You sure?
Yeah.
Okay.
I feel like I wasted your time, really.
Well, no, it's fine. It could have been quite nasty, couldn't it?
Yeah.
Well, the fire started sort of after, it must have been electric pounding on.
Yeah, yeah. All right, well, obviously, if you start to develop any symptoms or anything, just go and seek some medical help. But if you've not been injured, then,
I'm fine, yeah.
that's a lucky escape.
Yeah.
Look where you're going.
Yeah.
All right?
Yeah, thank you very much.
Okay, all right, take it easy.
Take care. No, it's not a waste, love, sweetheart.
The driver has been very lucky. The cables were carrying 11,000 volts.
It wouldn't have been a very nice position to be in. You'd have been very nervous about what potentially could happen. And having to sit and wait for somebody to turn the electricity off and then clear you from the fire must be quite a daunting experience.
It's time to return to base, quickly.
I feel sorry for him. He was trapped in this tractor with live power cables around him and this fire kind of getting bigger and bigger. So that's, clear that's very frightening for him.
Dennis from 9-8. We're clear, preparing to lift back to Nostrover.
Apart from a bent tractor, an acre of burned stubble and a farmhouse with no power, there's no serious damage. But the driver's ego may take some time to heal. North Yorkshire's one of the UK's most popular places to retire. 1 in 4 of the population is over 70, and many of the county's pensioners have no intention of slowing down.
Caution the 1 in, so 1 is no cautions. BMS, we have got 20% 101 cross checks. Confirm it.
Helimed 99 is scrambling to a village near York.
Need to watch out here over the trees.
It's a 75-year-old that's fallen 30 foot off a ladder.
Paramedics Lisa and James are on duty with Dr Neil. The accident has happened in the village of Westow.
Okay, mate, so in the 12 o'clock, we know where the DCA is.
Local paramedics are already there.
The intention will be once around just a recce, but I'm looking at that green field plus of the built-up area.
Lee's worried about obstacles near the patient's home.
Just trying to identify those wires. Are they wires or...
What, on the far side of the road?
Yeah.
Near the person? Yeah, I think it's a modern lamppost.
I'm just worried about this wire, where these wires are going if they're going into those.
Even a single strand phone line can bring down a helicopter.
Okay. Guys, you happy we're here?
Yep.
Dr Neil is heading out to assess the patient. Lisa will lead his treatment. He fell from this ladder. Retired builder Keith Parker was trying to repair his roof when he lost his balance. Why it happened is a mystery.
So he's had some TXA as a precaution.
I'll go and get a scoop.
Keith's in his mid-70s, but still fit. Until they can rule out a spinal injury, he'll be kept flat on his back.
Are you known to have waffy doos, Keith?
No, not really, no.
You don't often have dizzy doos or anything?
No.
What do you suffer with?
I have heart fibrillation.
Yeah.
But I mean, not really been a problem.
Been well managed,
really.
has it?
I've had that since I've been about 47, something like that.
His cardiac condition could be a factor. Fibrillation is an abnormal heartbeat.
So would you be normally confident going up that ladder with your normal health sort of issues that you have? You'd be quite confident going up a ladder like that? And you normally crack on and do all your own stuff, do you? Well, I normally do, yeah.
Keith likes DIY, and he refuses to slow down.
Being 74 and going up a ladder isn't a right good idea. I just thought I might share that thought of the day with you. What's your thoughts on that?
Well, no, that's probably right.
Keith doesn't seem to have any major injuries. He's lucky. It was a 20-foot fall.
So I think, because he's not triggering major trauma either, is it? Apart from his age, but then his obs are now fine.
His obs are more acceptable now, aren't they? So.
Yeah. So I think he'll be okay to go to York. What do you up nearest ED?
I agree. Yeah, York will be nearest ED for here, yeah.
Keith will travel to hospital by road. Doctors may be able to pin down the cause of his accident. There's no evidence on his heart trace.
He's had no chest pain, he just said he felt not right.
Yeah, so yeah.
Yeah. So on this occasion, Keith, you don't come to fly with us.
No,
but that's because
in the
you're
nicest
grounded.
possible way, they want it to stay like that as well. Okay.
That's a good thing, it's not a bad thing, it's a good thing.
As a precaution, Keith's been strapped to a scoop stretcher for his journey.
Anybody not happy? Prepare to lift and lift.
Keith will still undergo x-rays, but the team are confident he'll be home to put away his ladder for good.
Keith's managing really well. It looks like he has fallen off his ladder. He's landed on something that's relatively soft, so he's sort of almost ploughed back garden, so it's just earth, which is a soft landing. I suppose he follows the rules of when you get to a certain age, perhaps you shouldn't go up a ladder. But actually he's fine from a trauma perspective from what we can make out at the moment.
Keith's been given TXA, a blood clotting drug in case he has internal bleeding.
You comfy? Yeah. Nice.
In this corner of North Yorkshire, they have their own remedies for injuries.
Your house need locking up.
Whiskey.
You can't have whiskey.
You can't go to bed without whiskey.
You've got bad neighbours, you, haven't you? I'll bring you whiskey.
He can't have it, but if you could bring some out, that'll be good.
One single malt.
Is there any other sort of whiskey?
Dr Neil can't take up the offer. He's on duty, but he's leaving his patient in the hands of ground paramedics.
His blood pressure was initially a bit low,
but it looks like he's had a medical event or a faint which has precipitated his fall from the ladder. So we're more than happy after our assessment for him to go to a local hospital, which is sensible, which will be York District Hospital.
See you later anyway, guys. Take care.
It's time for the team to return to base.
Are you all right getting these ladders down as well?
Keith's going to be driven 15 miles into York.
With the help of these guys, I want you to just roll towards your left a little bit.
Simon, the prison officer badly injured when he hit a stationary lorry, needed surgery and a skin graft on his shattered leg.
At the time when the accident actually happened, I didn't think it was that serious. When I saw the air ambulance land, I was bemused as to why it was there. The actions that they did to get me able to get out of the car and get on to hospital could have saved my life.
He spent 6 days in hospital.
My injuries were multiple fractures to my kneecap, a laceration to my left knee. I could have lost both my legs, or ultimately at least my right leg. So I am very grateful to the first responders, the health by our ambulance service, and also to the surgeon at Sheffield Northern General, that without them I could have easily lost my life. I could have lost my legs.
Police blame the blinding low sun for the accident. Simon's hoping to return to work on the wings soon.
I'm the kind of person that will take every step as it comes, going about life as normal.
She's had 2 shocks and she's still in the air.
Sadly, Pamela, who suffered a cardiac arrest while being driven to A&E, died soon after being admitted to hospital. Her husband of 35 years remains grateful for the help he and Pamela received that day.
I'm on the paramedics on the helicopter. Tell me what's happened.
Yeah, I hit the wall with the head.
Cyclist Karen cracked 4 vertebrae in her neck and spine and had to spend 4 months in a body brace.
I just thought that was it, my number was up. I didn't know at that point, obviously, what I'd done, but it was just the scariest thing.
But her recovery didn't go smoothly, and almost a year after the crash, she had to undergo surgery to fuse 2 vertebrae together.
The back itself healed really, really well, but it was the nerves, which even, say, a year later when I ended up having surgery to remove discs, was the thing that caused the problems.
She's now back on her bike, always wearing a helmet.
Is that what you do for a living?
Yeah.
Builder.
And doctors at York Hospital ruled out a medical cause for a tyre builder Keith's fall from a ladder, and he was sent home to nurse cuts and bruises. He's hung up his ladders for good.